Colon cancer. So colon cancer is another serious cancer that is discovered in men. So with colon cancer, some of the first symptoms that we could possibly see would be gastrointestinal issues such as poor digestion, diarrhea, or probably one of the most common ones is blood. So if you're starting to notice that there's blood in your stool and or there's blood on your toilet paper constantly, then it's something we're going to want to look into. We have to rule out that it's not just it could possibly just be hemorrhoids, but it could also be colon cancer. Now, currently, men are being screened for colon cancer at about the age of 50. So a colonoscopy is basically whenever they go in there, they take a camera and they go in through your rectum and they go into your colon and they look at your entire colon. So just so you guys keep in mind, your colon is a large organ, right? So it's basically the last part of your digestive system. The nice thing about the colonoscopy is that it's safe and is extremely effective. Guys don't go in because they don't want to do it. And I get it. I understand. They don't want the idea of a camera going up their rectum. It just totally weirds them out and it freaks them out. Where they just don't want to. They would rather not know. But what I'm trying to encourage you guys is that you do want to know. So with that colonoscopy, right, we have what's called the ascending, transverse, and descending colon. So the camera will go in there and look at all aspects of it. If something doesn't look right, a common thing they find is polyps in your colon. So if they find polyps or abnormal tissue, they're going to go in there and take a piece of that tissue and they're going to biopsy. And they'll be able to tell you where you're at, if it is indeed cancer, if it's not cancer, or if it's possibly suspicious. So this starts to happen at the age of 50. If you have colon cancer in your family, I encourage you guys to get this test done sooner. We'll do it for guys that are 45 years old. I'll even do 40 because cancer is becoming more and more prevalent. In addition to the colonoscopy, some other things you can do to screen for colon cancer is basically a stool sample. And that's what it is. It's a poop sample. So basically, as your stool is going through your colon, it's going to pick up some of these cells. So with these stool samples, they'll actually have you give a sample. You do this at home. A box of kits can be sent to your house. You do it at home. And then you put your stool sample in the box. Yes, it is what you think you do. And you package it up and you ship it away. It's going to go to the lab. The lab's going to assess it and look at it. So this cancer screening via the stool is a possibility. Now, different doctors may have different opinions as to which one is the best. Right now, the standard is the colonoscopy first. And then there's also nothing called a virtual colonoscopy. And that's basically an imaging, right? We send you through an imaging machine and they take a picture of your colon to see if there could possibly be something wrong. So that is another option too. But I want to emphasize that a colonoscopy really is not bad. A colonoscopy is a great way. It's been tried and true. And if you're 50 years old, you need to get this done. If you're 52 and you haven't got it done, you're 2 years late. If you're 55, you're 5 years late. Get it done, especially if you have a family history of it. So how do we prevent colon cancer? So colon cancer, your biggest risk factor is going to be your family history. Then it's going to be lifestyle. Smoking is an increased risk factor for colon cancer. Also, a poor diet is increased risk of colon cancer. So if you're a smoker, you have a poor diet, and you eat a lot of processed food, and if you have cancer in your family, that's really not good. Those are all high risk factors for colon cancer. So what can you do? Get the weight off. Eat super clean, have a lot of green vegetables with a lot of fiber so that the stool moving through your system is always coming out of your system. And if you're smoking, please stop. If you're eating processed foods, please stop. If you're having a lot of sodas and so forth, McDonald's, please stop. All of those are going to increase your risk of colon cancer. So remember, guys, colon cancer is very important for men in regard to screening. If you guys have any questions, that's what we're here for you. When you come into the practice, any questions about cancer, please be sure to ask us, and we'll hope to get you guys screened, and we'll hope to get you guys, ensure that you guys do not have cancer. All right, another common cancer that guys get is testicular cancer. So whenever we talk about testicular cancer, guys are thinking, my God, I don't want that, and I'm not going to talk about it. When it comes to sex, as men, we're going to joke a lot about sex. We do because, it's funny and we like those kind of jokes. When it comes to our testicles, we're going to make a lot of jokes about that. When it comes to our penis, we're going to make a lot of jokes about that. So why do we shy away from the subject of cancer? And why do we shy away from the subject of testicular cancer? I don't know. I'm not quite sure. Call it our society, call it our norms, however we're raised, whatever. But the bottom line is it's a reality. So testicular cancer, of course, is a reality for men. How early should you be screening for this? Early. We always encourage our young men. Now, we're not seeing guys that are teenagers, but we like to encourage their parents to have the discussion with their young boys that they need to be checking themselves for testicular cancer. The nice thing about teaching a man, especially a young man, we're going to start around the age of 14, to be checking themselves for testicular cancer is because it's not totally uncommon. It happens. And usually whenever testicular cancer goes bad is whenever guys don't talk about it. It is because the parents don't talk to them about checking their testicles, or it's kind of this unsaid subject. I'm not going to tell people about my testicles. I don't want to know if something's going on, and the kids are either embarrassed to go to the doctor. So the biggest problem is this lack of communication. So testicular cancer does happen. How do you check yourself for testicular cancer? Well, it's really simple. You basically be checking yourself in the shower, especially in a warm shower, because remember, as the hotter it is, your testicles are going to sit lower. Because your testicles always want to be outside of your body because your testicles want to be in the lower temperature. Your testicles do not like to be hot. And the reason for that is because your sperm production is supposed to be happening around 2, 3, 4 degrees lower than your body's temperature. That's why our testicles are outside of our body. So fortunately, with them being outside of our body, we can touch them. We can feel them. So whenever we tell our guys to do the testicular test, this here is called the orgometer. You do not need one of these. So what an orgometer is basically giving us different sizes of different testicles. That's what an orgometer is. Now, again, you don't need one of these. I'm simply going to use our orgometer as a sample as to how a guy should be checking for his testicular cancer. And it really is pretty simple. So basically, you're just going to feel them. I tell my guys, just get familiar with how they feel. So that's all you're trying to do. And whenever you're feeling your testicles and you're rolling them between your fingers, you just want to be sure that they feel smooth, that you get familiar with the size of them. You know, our testicles are not these perfect balls, right? Your testicles actually have almost like an almond shape to them. And underneath your testicles, you're going to have some other organs there as well that are where you're going to store your sperm, which is completely natural, right? So you have to understand it's not going to be this completely smooth cylinder. It is going to be a little bit of almond shape. They're going to be different sizes. It's not uncommon to have one testicle be bigger than the other testicle. That's completely normal. The important take-home message here is that I'm feeling my testicles on a regular basis. How often should you be doing this? Well, I mean, you could do it as much as you want. You could do it once every few months. You can make a note of it to do it every 6 months. You make a note of it once a year would be sufficient. The important thing is here, as a young man, you allow yourself to be comfortable with touching your testicles. And as parents, it's our duty to tell our young boys that it's okay to do this and that you should be doing this. So if there's anything that's wrong, they can bring it up to you. So how do we discover something's wrong? It's simply because whenever you become familiar with how your testicles feel, if there's an abnormality, you're going to notice something. There's going to be, quite frankly, a bump, a mass. You feel something growing on there that isn't quite right. Whenever that happens, then if you have a nice communication with your boys and or yourself and your physician, then you can bring it up to their attention and we can instantly go get it checked out. It's very easy to go get it checked out. We have ultrasounds and so forth. We can put on the testicles to see. So like I said, the thing about testicular cancer is that it is common and you don't have to be a young man. This can really happen at pretty much any time in a man's life. So regardless of where you are in your life, as a man, you should be checking your testicles. Testicular cancer is real. If you guys can find it early, that is the best thing. Like any cancers, the earlier we find it, the better. I think the biggest risk factor is this miscommunication. I think it's this fear that we have about talking about sex. We're talking about our genitals and telling our men, especially young men, it's okay to touch your testicles. You should be touching your testicles. You should become familiar with them. It is this lack of information, this uncomfortableness we have to talk about sex and our genitals. That is what I truly believe is killing a lot of men from testicular cancer because there's a simple embarrassment about talking about this stuff. So we got to take care of that stuff, guys. We got to let it go. Sex is natural. Sex is fun. Sex is something that's going to be happening in every man's life. So guys, do you want to take care of your sexual organs, including your testicles, because testicular cancer is a real thing. It's super easy to screen. And best of all, you can start doing the screening yourself.